What are the normal changes in the thyroid gland associated with pregnancy? This is Dr. Chhaya Makhija, board certified endocrinologist and lifestyle medicine specialist. So let's get into the details. Now I'll be talking to you about 3 specific changes which are normal or physiological in pregnancy. Number 1 is hormonal change, that is the human chorionic gonadotropin, that's HCG, as well as estrogen levels are elevated during pregnancy. So what does HCG do? It tends to mimic the thyroid stimulating hormone. So the TSH may appear to be low as it is stimulating, HCG is stimulating the thyroid gland to produce slight extra thyroid hormone, which may lead to an appearance of low TSH specifically in the first trimester, and gradually the TSH normalizes. This does not need hyperthyroid management with any medications or further measures. Number 2, estrogen. Estrogen increases the thyroid binding globulin. What is that? It is basically a protein which is bound to the free thyroid hormones, and that equates it to total T4 or total T3. Now, because the total thyroid binding globulin is increased due to estrogen effect, the amount of free thyroid hormone circulating in the bloodstream during pregnancy may appear to be normal, but the total amount of the thyroid hormone is either high normal or it will be slightly elevated. Again, normal physiological changes. It does not indicate hyperthyroidism. Number 3 is the actual gland size. So the thyroid gland may increase in size by about 10 to 15% of the original thyroid gland size during pregnancy. Again, it may not be clinically apparent during clinical examination by your physician or even by you, but it is expected normal physiological change. Now, if you notice an enlargement which is palpable or which feels abnormal, or if you have symptoms, definitely seek out for the right medical care, maybe an ultrasound or even thyroid hormone function test. Follow along for more changes during pregnancy and in women's health, as well as thyroid and bone health, thyroid and women's health. Thyroid and the disorder called as thyroiditis. What is it? This is Dr. Chhaya Makhija, board certified endocrinologist and lifestyle medicine specialist. So let's look into it. Now, in general, in science, in medicine, itis is basically inflammation related to that particular organ or part of the body. So thyroiditis is a general terminology for inflammation of the thyroid gland. Now that could be because of multiple reasons. The most common cause is Hashimoto's thyroiditis, which is the most common cause for primary hypothyroidism in the United States of America. The other could be painless thyroiditis or something called as postpartum thyroiditis, which is a transient inflammation of the thyroid gland, and it may present with initial hyperthyroidism and then may get into hypothyroid phase and then into normal thyroid function test most of the times. So it's very important to track the thyroid hormone as well as treat the individual symptomatically rather than giving them anti-thyroid drugs. Other aspects are medication-induced thyroiditis. So medications like amiodarone, interferon can also cause inflammation of the thyroid, which will be termed as thyroiditis, but may have these exact same phases of hyperthyroidism, hypothyroidism, and normalization, or they may become hyperthyroid or hypothyroid. So hence, it's very important to follow or track these levels as well as patients' clinical symptoms to understand what would be the next phase of the thyroid disorder versus is there normalization. Now, if you have any doubts on what exactly is going on, there are certain tests which can actually help and serve as an adjunct in helping us as clinicians, as endocrinologists, to make a decision. And those could include, other than blood work, your antibodies, which are thyroid peroxidase antibodies for Hashimoto's, thyroid stimulating antibodies for Graves' disease, as well as there would be ultrasound, which helps us to indicate if there is increased vascularization, increased blood flow in the thyroid gland, which might suggest either thyroiditis or it might suggest Graves' disease. The other aspect is radioactive uptake and scan, which is iodine based, and it's a nuclear medicine scan, which is only done in individuals who have hyperthyroidism, and we cannot figure out a cause if it's thyroiditis versus thyroid nodules versus Graves' disease. So there are a lot of nuances I'm sure you've understood by the end of this video. Seek the right thyroid expertise. Get to an endocrinologist if you're dealing with constant fluctuations in your thyroid hormone, and follow along as I'll share more insights on thyroid gland. Few important tips that I discuss with my patients who are either planning for conception, pregnancy, or are going to be pregnant or are currently pregnant and refer to me right away if they have hypothyroidism. This is Dr. Chhaya Makhija, board certified endocrinologist and lifestyle medicine specialist. And let me share some very important tips regarding hypothyroidism and pregnancy. Number one, if you have a diagnosis of hypothyroidism and are on levothyroxine or any form of thyroid hormone replacement therapy, discuss with your clinician about your plan for conception, pregnancy, or even infertility treatments so that your thyroid hormone levels are optimized to meet those goals. Number two, if you've conceived, go ahead and talk to your clinician, inform them right away because your thyroid hormone dose will need adjustment. The reason being, there are specific first trimester, second trimester, and third trimester thyroid hormone ranges, which are different or variations occur as compared to, say, adults who are not pregnant or females who are not pregnant. This is important because the first 12 to 16 weeks of your child's brain development is dependent on the maternal, the mother's thyroid hormone. And if you are taking thyroid hormone replacement therapy, the dose of that thyroid hormone replacement therapy has to be up titrated or slightly increased depending on where your levels are, depending on what your current dose is, depending on if you're pregnant or planning to conceive. Now, if you're unsure as to how the dose needs to be adjusted or your healthcare team is unsure, then definitely reach out for expertise, reach out to an expert endocrinologist who can help you with the titration so that you can have a healthy pregnancy. Thyroid and women's health. Now, thyroid gland as well as thyroid hormone is very crucial in women's health. In early childhood as well as during adolescent period, it can affect growth as well as the menstrual period or the menstrual cycles. So individuals with hypothyroidism can experience less frequent menstrual cycles called oligomenorrhea or even amenorrhea, versus hyperthyroidism can also cause menorrhagia or excessive bleeding. Number two is if there is a thyroid disorder like hyper or hypothyroidism, specifically hypothyroidism, which is not treated, it can affect ovulation, it can affect pregnancy. So there are higher chances of infertility because of reduced ovulation in these individuals who have a thyroid disorder, which is untreated, or even subclinical hypothyroidism, which is not treated, related to elevated TPO antibodies or Hashimoto's. The third aspect is during pregnancy. So if individuals have a thyroid disorder which is not appropriately treated, either Graves' disease or thyroiditis or even hypothyroidism, then it can impact the pregnancy outcomes. Number four is postpartum period. During postpartum period, it's not uncommon to see a relapse or a new onset of autoimmune thyroid disease, which could be postpartum thyroiditis, or it could be an autoimmune thyroid disorder like Hashimoto's or even Graves' disease. Number five is during the perimenopause and menopause period. Now, hypothyroid symptoms or even hyperthyroid symptoms like anxiety, palpitations can mimic the menopausal symptoms, whereas thyroid disorder, specifically hypothyroidism, the risk of it increases as women enter into the menopausal phase. So our conclusion, our goal is to make sure that most of the times, if you are asymptomatic, good to get your thyroid hormone test during your annual physical examination, or if you encounter any symptoms related to menstrual disturbances or your overall well-being, it would be wise and prudent to get your thyroid hormone tested and discuss this with your healthcare team. Follow along as I share more tips about your thyroid health. Phases in a woman's life where you should not miss testing for thyroid hormone function test. This is Dr. Chhaya Makhija, board certified endocrinologist and lifestyle medicine specialist. During childhood and adolescent phase, if there is a impaired growth healing for that particular female. If there are irregular menstrual cycles or amenorrhea, that is absence of menstrual cycles, or spaced out menstrual cycles, or even excessive bleeding, menorrhagia, check the thyroid function test. During preconception, conception period, or any causes to determine infertility or anovulation, the good time is to check thyroid function test. During the postpartum period, if there are symptoms of tremors, palpitations, postpartum depression, anxiety, good time to look at the thyroid function test because the risk of autoimmune thyroid disease is higher during postpartum period. The next phase is perimenopause and menopause. Thyroid disorder can mimic perimenopausal and menopausal symptoms, and in general, the risk of hypothyroidism in women tends to increase during that period, especially after menopause. So get your thyroid hormone function test during that period. Now, at other times, if you have symptoms, talk to your clinician. It would be wise to get it when you have symptoms as well. Follow along as I share more insights on your thyroid health.